Bismillahirrahmanirrahim. The quote of the day is by Joel Lieberman. He quotes that I mean accidents happen. You learn from them and you try to make sure they don't happen again. The topic of today's presentation is accidents and Haddon's matrix under the supervision of Dr. Saira Afzal. The learning outlines of today's presentation is introduction to injury and accident, types of accident, risk factors of different types of injuries, issues of road traffic accidents, different levels of prevention in relation to accidents and their control, Haddon's matrix, recent advances, and at the end are the MCQs. By the end of this presentation, participants will be able to describe what is injury and accident, what are the different types of accidents, risk factors of different types of injuries, issues of road traffic accidents, different levels of prevention in relation to accidents and their control, Haddon's matrix, and how it helps to identify the risk factor of accidents. Now, injury. What is injury? An injury is the physical damage that results when the human body is suddenly or briefly subjected to intolerable levels of energy. It can be bodily lesion resulting from acute exposure to energy in amounts that exceed the threshold of physiological tolerance. The time between the exposure to the energy and the appearance of energy is short, or it can be impairment of function resulting from a lack of one or more elements, such as in drowning, strangulation, or freezing. Injuries result from the transfer of one of the five types of energy to the body. It can maybe the mechanical or kinetic energy in the that are in the form of falls, motor vehicle accidents, and assaults. Or it can be in the form of thermal energy, for example, in burns and scalds. Or it can be electrical energy, as it is in electrocution and lightning strikes. It can be in the form of chemical energy, as it is in corrosion and chemical burns, and it can be in the form of radiation, such as in electromagnetic radiations. So the intent of energy. If the energy is intentional, it can be intentional or intentional. The intentional injury is called the accident. Intentional injuries can be self-inflicted, inflicted or inflicted by the others. No accident. Accident, it is an event that is unexpected, unintended, unforetold, unforeseen, and that may result in injury to a person or a death of a person or damage to property. In 1956, WHO advisory group defined accident as unpremeditated event resulting in irrecognizable damage. Accidents are the part of price we are paying for technological advances. Like other diseases, accidents are also having the natural history of disease and follow the same epidemiological pattern as other diseases, that is the agent, host, and the environment that interacts together to produce the injury or the damage. Now, this is the leading contributor in global diseases. Road traffic injuries in 1990 ranked 9, and in 2020 it ranked to the third in number. No measurement of problem. Accidents can be measured by the mortality, morbidity, or disability. Mortality measures are proportionate mortality rate, that is the number of deaths due to accidents out of 100 total deaths, or the number of deaths per million population. Now, who are the killed in road traffic accident? These are defined as any person who was killed outright or who died within 30 days as a result of accident. Death rate per 1,000 registered vehicles per year, or the number of accidents or fatalities as a ratio of number of vehicles per kilometer or passengers per kilometer. The other measures can be the morbidity, that are measured in terms of slight injury or serious injuries, or it can be disability. Disability can be in the form of temporary or permanent, or it can be partial or total disability, but it does not take into consideration the physiological or the social aspects of an accident or injury. No type of accidents. Accidents can be road traffic accidents or the domestic accident in the form of drowning, burns, falls. It can be the industrial, railway, or the violence. Now, the causes of accidents. Accidents are complex phenomena with multiple causations. Etiologic factors are classified into human, environmental, and psychosocial factors that are described. This is a picture showing the causation of accidents. The human factor that are involved are maybe the age, sex, education, psychological factor, and lack of body protection. The environmental factors contributing to the accidents are related to the road, relating to the vehicles, bad weather, mixed factor. These all, when bad, increase the vulnerability and risk of the accidents. And other precipitating factors can lead to the accidents. The human factors that lead to road traffic accidents are um, younger age groups are more involved in road traffic accidents. Males are more involved. Low educational status groups are more involved in road traffic accidents. The medical condition of persons that are having chronic diseases are suffering from sudden illness, heart attack, or impaired vision have more chances of accidents. Persons who are fatigued during driving uh, and if the person have are not having the protective measures like helmet and safety belts, there is the more chances of accidents. The psychosocial factors that contributes to the accidents are lack of experience, risk-taking behavior, impulsiveness, defective judgment, delay in decision, aggressiveness, poor perception, and family dysfunction. The environmental factors can be related to the vehicles and it can be related to the roads. Related to the vehicles are high-speed vehicles, poorly maintained vehicles, and large number of two or three wheelers like the motorcycles or rickshaws, overloaded buses and trucks, and low driving standards. Bad weather also contribute to the accidents. The environmental factors related to the roads are defective and narrow roads, defective layout of the crossroads, speed breakers, and poor lighting on the roads. The other factors contributing to the accidents are inadequate laws and mixed traffic contributing of pedestrians, animals, and vehicles. Bad weather. Recently, the incident that took place in Murray on 7th of January 2022. In this, the snowstorm occurred in Murray, and the snow was more than 4 feet. It kills about 23 domestic tourists who had visited to seek the thick snow. Many died as temperature fell to around -8 degrees Celsius. The precipitating factors can be increased emotional stress, alcohol consumption or intoxication during driving, stolen uh, vehicles traveling in the form of groups, road traffic accident. Road safety is no accident was the slogan given by WHO for World Health Day on 2004. 85% of all road accidents and deaths occur in developing countries and nearly half in Asia Pacific region. The risk factors involved in road traffic accidents are due to speeds, like the pedestrians can have less damage if the vehicle speed is less than 30 km per hour. There is 90% chance of survival for the pedestrians, and if the speed is more than 45 km per hour, there is 50% chance of survival. In some areas, like the schools, hospitals, the speed limit should be less than the 30 km per hour. Low speed have better health outcomes if there is any injury or accident has occurred. Know the drink and drive risk factor. Drinking and driving increases both the risk of crash and likelihood that the death or a serious injury will result. The risk of being involved in a crash increases significantly above a blood alcohol concentration of 0.04 gram per deciliter. Laws that establish blood alcohol concentration of 0.05 gram per deciliter or below are effective at reducing the number of alcohol-related crashes. Enforcing sobriety checkpoints and random breath tests can lead to reductions in alcohol-related crashes by about 20% and have shown to be very cost-effective. Now, the motorcycle helmets. Wearing a motorcycle helmet correctly can reduce the risk of death by almost 40% and the risk of severe injury by 70%. When motorcycle helmet laws are enforced effectively, helmet wearing rates can increase to over 90%. Requiring helmets to meet a recognized safety standard is important to ensure that helmets can effectively reduce the impact of collision to the head in the event of a crash. Now, seat belts and child restraints. Wearing car seatbelt reduces the risk of fatality among the front seat passengers by 40 to 50% and of the back seat passengers by between 25 to 75%. Mandatory seatbelt laws and their enforcement have been shown to be very effective at increasing seatbelt wearing rates. It, if correctly installed and used, the seatbelts and child restraints reduce deaths among infants by approximately 70% and deaths among small children by between 54 to 80%. Another distracted driving. There are many types of distractions that can lead to impaired driving, but recently there has been a marked increase around the world in the use of mobile phones by drivers that is becoming a growing concern for road safety. The distraction caused by mobile phones can be impaired driving performance in a number of ways. For example, longer reaction times, probably braking reaction time, but also reaction to traffic signals, impaired ability to keep in the correct lane, and shorter following distances. Text messages also results in considerably reduced driving performance with young drivers at particular risk of effects of distraction resulting from its use. Drivers using a mobile phone are approximately 4 times more likely to be involved in a crash than when driver does not use a phone. Hand-free phones are now much safer than hand-free phone sets. While there is little concrete evidence yet on how to reduce mobile phone use while driving, government need to be provocative. Accidents in developing countries. How accidents in developing countries differ from the developed countries. In developing countries, two-wheeler vehicles are more on the roads and pedestrians are more. Uh, the roads on roads, overcrowded buses are seen. There is a large number of old and poorly maintained vehicles and overloaded buses. Unusual behavior of human and animals. There are poor road standards and disregard towards traffic rules. Now the domestic accidents. Accidents which take place in home or in its immediate surrounding, which are not connected with traffic vehicles or sports. Common domestic accidents are drowning by burns by hot liquid, electricity, crackers are chemicals, and falls, injury by sharp objects and animal bites. Now the drowning. After immersion in water, victim loses consciousness within 2 minutes and irreversible brain damage occurs at 4 to 6 minutes. Risk factors of drowning are younger children are more prone to drowning than adults. Males are more prone, probably their work is in the water, and accessibility to the water. People living near the rivers, ponds, or the sea are more vulnerable to drowning. And infants, if left unsupervised, they have the chances of drowning. Unsafe transportation, vehicles, boats, and ships. Passengers are the pilots using consumed alcohol, the medical conditions of the people while are near the water, for example, epilepsy, unsafe tourism, and floods and tsunamis. Prevention and control of drowning. Availability of life jackets and flotation devices around pools and boats. Supervision of children by adults. Fencing of lakes and ponds. Creation of safety standards for public and private swimming pools. Ensuring availability of weather reports to fishermen and to those working on river and seas. Now the burns. A burn is an injury to the skin or other organic tissue primarily caused by by heat or radiation, radioactivity, electricity, friction, or contact with the chemicals. Thermal burns occurs when some or all of the cells in the skin or other tissues are destroyed by hot liquids, hot solids, or flame. Factors associated with burns are explosion of pressure stove, cooking on open fire, use of open fire during winter, use of inflammable material, uh, or when the fire is used as a method of suicide. The prevention for the burns include are stable stoves and lamps, replacement of pressure stoves with wick and gas stoves, installation of fire and smoke alarm, promotion of cold weather for first aid and cold water for first aid and burns. The risk factors for burns are careless smoking. Cigarettes are the leading cause of house fires. Absent or non-functioning smoke detectors. The presence of functioning detector decreases the risk of death by fire by 60%. Use of wood stoves, exposed heating sources or electrical cords, unsafe storage of flammable or cosmetic materials, Water heaters set above 20 degree Fahrenheit, microwave heated foods and containers, substandard or older housing, substance abuse, use of alcohol and illegal drugs increases the risk when someone is working with the fire. Now the first aid during the burns. The do's and don'ts of the burns management are the do's the person that can do for the burn management is cool the burn under the running cold tap water for 10 to 20 minutes and cover the wound with a loose sterile dressing and seek immediate medical advice and monitor for shock and hypothermia. The don'ts that have don't to be done after the after the burn injury are don't use any butter or toothpaste to cool the burn or other home remedies, for example, turmeric powder. Don't use ice to cool the burn because the ice will deepen the burn. Don't remove any cloth that stuck to the burn or don't opens the breast blisters. This is the picture showing the that you don't have to do is don't apply any ointment against the medical advice. You only have to put your burn wound in the cold water for 10 to 20 minutes. Don't put ice on the wound uh, uh, and cover the wound with the sterile dressing. Now the poisoning. Most common agents of poisoning are kerosene oil, pesticides, household chemicals, drugs. Kerosene poisoning is common among children as it is a common household that is kept in houses. On the falls, large number of hospital visits among children and young adults for non-fatal ages. They fall from the roof, balcony, staircase, windows are common. Amongst it is also common in construction workers. Uh, the preventive measures that are adopted to reduce the falls are safer playground, use of mud and sand surfaces instead of paved ones, safe furniture and house design, use of grills on windows, safer design of stairs, balconies, rooftops with railings and walls, safe working techniques for construction workers. For the industrial accidents, about 580 million workers in Southeast Asia region uh, are workers and 60 to 80% are in small scale units. The preventive measures that are adopted in industry to prevent accidents are ensuring the cost effective protective measures, enforcing safety regulations and standards, creating awareness among the workers. Now, violence is another form of the accident. The risk factor for violent behavior are exposure to violent and societal acceptability of violence as a mode to solve the problem, availability of lethal weapons for violence at the home, and consumption of alcohol or other intoxications like benzodiazepines, barbiturates, or cannabis. Suicides are increasing in Southeast Asia Pacific region. Common methods of suicide are hanging and drowning. 70% of suicidal cases are in the age range of 15 to 35 years. Uh, Male to female ratio of suicide, females are more prone to suicide. There are more female deaths due to suicides. In 2015, the suicide rate in Pakistan was approximately 16 deaths per lakh inhabitants and nearly 1.5 times of the global average of the suicide rate. Similarly, suicide represents 9.7% of all deaths. These are the three E's of injury prevention, that are education, enforcement, and engineering, through which the accidents can be prevented. Education measures include the raising awareness, changing behaviors, for example, Safe Kids Week, first aid training of the community. Enforcement involves the uh, uh, enforcement of the policies that can be formal or informal, like the seatbelt legislation or fines on if someone is not wearing the seatbelt while driving, and alcohol legislations if somebody is driving while he is drunk. Engineering measures include creating health promoting environments and child resistant caps, like for the medicines or the poisonous or for the chemicals, and bike separate bike paths on the roads for the motorcycles. Uh, the strategies can be the active or the passive. Passive strategies include, for example, airbags in the cars when the individual don't have to do anything. Active strategies include when the individual has to take action to to prevent from the accident. For example, buying and wearing a helmet during driving a motorbike. Now, the prevention of accidents. It is a multi-sector approach for prevention. First one is the data collection. There should be a basic reporting system of all accidents. The national data should be supplemented by special surveys and in-depth studies. These studies will bring out the risk factors, the circumstances, and chain of events leading to the accidents. These details are rarely provided by the basic reporting system. Detailed environmental data relating to the road, vehicle, weather, and others must also be collected. The police have a statutory duty in many countries to investigate accidents for legal as well as preventive purposes. The data collection system should recognize this and take police records as their starting point. Without adequate data collection, analysis and interpretation, there could be no effective countermeasures, evaluations, and strategies for prevention. There is the safety education that is very much important. There is a widespread belief that accidents are inevitable. This fatalistic attitude must be curbed. Safety education must begin with school children. The drivers need to be trained in proper maintenance of vehicles and safe driving. Young people need to be educated regarding risk factors, traffic routes, and safety precautions. They should also be trained in first aid. It has been amply said that if accident is a disease, then education is its vaccine. Now, the promotion of safety measures. Seat belts. The use of seat belts reduces the number of fatalities and non-fatal injuries by approximately 50%. They should be made compulsory for cars, light trucks, and similar vehicles. The safety helmets. They reduce the risk of head injury by 30% on average and that of fatalities by 40%. They prevent laceration of the scalp to a greater extent. Recently, the full face integral helmet has become very popular. The children. Another safety measure is to ensure that children remain seated when they are in a vehicle. They should be prohibited to take the front seats of the cars. A few countries have introduced laws which require that children of under 12 to 15 years in cars to be in the rear seats only. These comprise use of door locks, proper vehicle design, use of laminated high penetration resistance windscreen glasses. Now the promotion of safety measures. uh, the other is the alcohol and other drugs uh, that are used. Alcohol impairs driving ability and increases the risk of accident as well as severity of all consequences. Conclusions of surveys carried out in several countries have shown that alcohol is the direct cause of 30 to 50% of severe road accidents. Drugs such as barbiturates, amphetamines, and cannabis impairs one's ability to drive safely. They should be avoided totally. Now, the primary care. Planning, organization, and management of treatment and an emergency care services should be a fundamental element of healthcare services. Emergency care should begin at the accident site, continue during transportation, and conclude in the hospital emergency room. At any of these stages, a life may be saved or lost, depending upon the skill of the healthcare worker and the availability of available emergency equipment. To achieve these ends, there should be an accident services organization and one fully equipped specialized trauma care hospital in all major cities, as the accidental emergency services are available in universities, that is 1122. The elimination of causative factors. The factors which tend to cause the accident must be sought out and eliminated. For example, improvement of roads, imposition of speed limits, and making of danger points. Now, the enforcement of laws. Legislation embodies codified set of rules. These are enforced by the state to prevent accidents. These include driving tests, medical fitness of the drivers, enforcement of speed, checking of speed limits, compulsory wearing of seat belts and crash helmets, checking of blood alcohol concentrations, roadside breath test for alcohol consumers, regular inspection of vehicles, periodic re-examination drivers over the age of 55 and others. Other rehabilitation services for the victims include the medical, social, and occupational and accident research. The future of accident prevention is in research. Such research will be concerned with gathering precise information about the extent, type, and other characteristics of accidents, correlating accident experience with personal attributes and environments in which accidents occur, investigating new and better methods of altering human behavior, seeking ways to make environments safer, and evaluating more precisely the efficiency of control measures. This area is now termed as accidentology. Now, this is the Pakistan Bureau of Statistics for the year 2019 and 20. Its annual report for the traffic accident is the total person killed are 5,436 and total number of vehicles involved in accidents are 12,694. This is the World Bank report of causes of death by injury, that is the percentage of total. There are about 7 deaths due to injuries in Pakistan in year 2019. Accidents management and safe cities are also elaborated in the Sustainable Development Goals in number 3, that is good health and well-being, and number 11, that is sustainable cities and the communities. Now the recent updates. This is the facts and figures by WHO about the road traffic injuries. Approximately 1.3 million people die each year as a result of road traffic crashes. The United Nations General Assembly has set an ambitious target of having the global number of deaths and injuries from road traffic crashes by 2030. The road traffic crashes cost more 23% of their GDP. More than half of the all road traffic deaths are among vulnerable road users, that are pedestrians, cyclists, and motorcyclists. 93% of world's fatalities on the roads occur in low and middle income countries, even though these countries have approximately 60% of the world's vehicles. Road traffic injuries are the leading cause of death for children and young adults for the age range of 5 to 29 years of age. This is an article that is on the prevalence of behavioral risk factors for road traffic injuries in the city of Sao Paulo, that is in Brazil, and the findings from the Bloomberg Initiative for Global Road Safety for the year of 2015 and 17. Sao Paulo is one of the world's largest urban areas, and it was selected as one of the 10 cities of the Bloomberg Initiative for a Global Road Safety project. The city has reached a significant decline in road traffic mortality during the last decade, that is 7 deaths per lakh inhabitants in 2016. The objective of this article is to evaluate the performance of interventions aiming to reduce the prevalence of 4 key road safety risk factors, that are speeding, drink and drive, seat belt, and helmet use during the year 2015 and 17. The findings of this research is the prevalence of speeding at baseline 10% decreased substantially to 5% in 2016 following citywide speed limit reduction interventions. Drivers testing above the legal blood alcohol concentration limit of 0.01% presented a decreasing trend from 4.1 to 1.2%. Driver seatbelt use rate has kept constant at approximately 90%, and nearly all motorcycle drivers wearing the helmets correctly. The conclusion and policy implications from this research is speeding and drink driving are the most prevalent risk factors observed among drivers, but interventions addressing these behaviors have demonstrated a positive association with their reduction. Future strategies addressing rear seat belt use and correct helmet wearing should also be promoted. Now there is another concept, and that is lives, that is given by WHO in 2017, that is to save lives, priority components and interventions. It has 6 components and 22 interventions. The 6 components stands from the lives, that is LIVES. First component is speed management. The interventions regarding the speed management are establish and enforce speed limit laws nationwide, locally, and in cities. Build or modify roads with calm traffic, for example, roundabouts, round narrowing, speed bumps, and rumble strips. Require car makers to install new technologies such as intelligent speed adaptation to help drivers keep to speed limits. Uh, second, uh, Second one is leadership on road safety. And the interventions needed regarding this are create an agency to to spearhead road safety, develop and fund a road safety strategy, and evaluate the impact of safety strategies, monitor road safety by strengthening data systems, raise awareness and public support through education and campaigns. The third one is infrastructure design and improvement. There are also interventions regarding these. Other is the vehicle safety standards. In this, the interventions needed are establish and enforce motor vehicle safety standard regulations related to the seat belt. Seat belt encourages frontal impact, side impact, electronic stability control, pedestrian protection, and isofix child restraint points. Enforcement of traffic laws. The intervention needed regarding this are establishment and enforce laws of national, local, and city levels on drinking and driving, motorcycle helmets, seat belts, and child restraints. The last one is the survival after a crash. Develop a organized and integrated pre-hospital and facility-based emergency care services. Train those who respond to crashes in basic emergency care. Promote community first responder training. Know the Haddon's matrix. It is given by the William Haddon in 1970. Haddon's matrix is a brainstorming tool that combines the epidemiology triangle of host, agent, and environment to the levels of prevention. This combination gives us a way to look at planning for injury interventions and preventing strategies by phases in the time of the event. This exercise is also helpful when used in conjunction with the planning your data collection. Interventions that addresses multiple levels more than one E, that are the E's of the prevention for the injury, or different boxes of Haddon matrix are most effective for injury prevention. The goal is to fill in the 12 empty boxes where the two elements intersect with the risk factor or potential intervention strategy. Then you can see that there are multiple points one could intervene in preventing, that is pre-event or reducing event or post injuries from injury event. No, no, these are the time series perspectives. That is the pre-event that is before the accident has occurred, and event when the accident occurred, and post-event when the accident has occurred, and the interventions are precautionary measures that has to be taken after the accident. When this is plotted with the epidemiological triangle, we get the Haddon's matrix. The Haddon's matrix is in the form of table where the time duration is on the y-axis and the epidemiological factors are on the x-axis. This is an example of Haddon's matrix for motor vehicle accidents. The pre-events that could be taken to prevent the accidents are the experienced driving skills of the driver. Age should be suitable of the driver. Driver should not be alcoholic or intoxicated with drugs, and the driver should not be distracted from by using mobile phones or conversating with other passengers. The giant factors that can be prevented before the accident are the condition of tires, breakers, and headlights. The environmental factors that are the physical and social one that can be undertaken to prevent the accident uh, are the rain, dark, unmarked intersections, and arguing with the passenger that argue with the driver. The other